Hey there, I am Sandi Star, and I'm here with Dr. Kremer from Del Mar Integrative Medicine in Del Mar, and we're super excited to talk about inflammation. As everybody knows, inflammation, we're going to go ahead and share in a few seconds a presentation we want to kind of go through just to give you some great visuals and some good bullets and some good insights. So welcome, Dr. Kremer.
Well, it's great to be here. And I actually love talking about inflammation and especially anti-inflammation because many people don't realize that inflammation is one of the main things we are fighting to stay disease-free. And so when you think about it, inflammation, anything that has itis attached to it means inflammation. So if you have arthritis, that's inflammation of the joints. If you have gastritis, that's inflammation of your stomach. If you have appendicitis, that's inflammation of your appendix. Myocarditis, it's inflammation of your heart. So all the itises are inflammation. And we have developed a program that can help you stop that from happening. You know, if you already have it, and we always have some, but if you already have it, you can reverse it, and we can show you ways from preventing it from happening.
Yeah, so I'm going to go ahead and share the screen, but while I'm doing that, maybe chat a second or two about a minute or two about some of the regenerative things you do to really address some inflammation, like the PRP and the stem cells and that, because the anti-inflammatory program is a great thing to come on board with right after these treatments so that you're keeping that inflammation in check.
Yeah. So we do here at Del Mar Integrative, we do an anti-inflammatory program, but I also do regenerative therapy with stem cells. So if you happen to have a bad knee, for example, with a little bit of inflammation, we can inject it with either platelet-rich plasma, which comes from your own blood, or we can inject it with stem cells, which will help to regenerate cartilage. It can turn into bones, ligaments, muscles, tendons, cartilage, and help you regenerate that. So it's all part of getting you back to normal function by repairing damage that's going on.
Yeah, it's awesome. Stem cells amazing, and the exosomes as well, right? You're doing those.
Yeah, exosomes come, for those of you who don't know, most people don't know that exosomes actually, spelled EXOSOMES, come from stem cells, but they're not actually cells. They're nanovesicles. They're so small, there's 15 billion of them in a fifth of a teaspoon. Now, mind you, I've never counted them, but they help signal your own stem cells to do a better job. They have a strong anti-inflammatory effect, and because they're so small, they can go to places that stem cells cannot go. For example, diabetes, which is traditionally a microvascular disease, these exosomes can get in the microvasculature and help to repair them. That's the small vessels that are causing neuropathy and other diabetic problems.
That's fascinating. And the more I learn about it, the more I just blown away how we can do these things that are natural for our bodies rather than doing synthetic medications and things like that. They really just mask everything. They don't really get in underneath to help healing. So that's awesome. Well, so inflammation, we have acute and chronic, right? So acute is actually a good thing, right? You get a cut, your body responds, sends all of the energy and blood flow to that area, starts healing it. It does what it needs to do, and then it goes back into balance again and calms down, right? So acute inflammation is definitely a protective mechanism in our bodies that we want. But, right, and you've seen this all the time too, is the chronic inflammation is not a good thing, right? So a lot of times the acute inflammation can just keep going and not stop with injuries, but also there's a lot of other factors that play a role, including diet, lifestyle, as an ER doctor, you've seen people come in left and right with chronic inflammation, right? Metabolic conditions and things like that. And we'll kind of talk about that too. But any thoughts on that?
Yeah, what we try to, as Sandy mentioned, acute inflammation is necessary. Like if you have an injury or a cut or something, you have an inflammatory response to that area, and that helps it heal. But if that inflammation doesn't go away, then you have chronic inflammation, and that's not good. Chronic inflammation can can cause autoimmune disorders,
Yes.
and that can affect your whole system. So we want to address these are some of the things that chronic inflammation can lead to: cancer, heart disease, lung disease, diabetes, neurologic diseases, arthritis, autoimmune diseases. Probably most of you have heard of Hashimoto's thyroiditis. Well, that's an autoimmune disease that is very prevalent, and I think that a lot has to do with our lifestyle and this chronic inflammation. If we can eliminate that, we can certainly prevent some autoimmune disease and help to ameliorate autoimmune disease that we already have.
Absolutely, and the Hashimoto's ties a lot into leaky gut. So that's a whole nother topic, but definitely. So yeah, a lot of, like they say, 80% of disease is from chronic inflammation. So we want to make sure we don't have chronic inflammation is the bottom line. There's also a lot of diet triggers, lifestyle triggers that can contribute to the chronic inflammation. Sugar is a huge one. In fact, sugar can decrease your immune system up to 50%. It's really not good for you. So we got to keep that in check. That's with like refined carbohydrates, just pure out sugar, bad fats, right, that you're going to find in processed foods. The trans fats are really dangerous for hearts. So if you're dealing with cholesterol issues and just heart issues, the trans fats are really going to be a big problem. A lot of things can cause the inflammation. And so you think about the foods you're eating all the time, ongoing, it's going to affect that inflammation in your body, either in a good way or a bad way. So these are a lot of the foods that can be inflammatory. The top two ones I talk about all the time is gluten and cow dairy. And a lot of the processed meats and the conventional foods, things like that, that are jacked up with hormones and fed all kinds of crazy stuff.
Sometimes when I'm talking to patients, I wrote a book on a plant-based eating program, but I'll talk about that later. But when I'm talking to patients, I just want to, a lot of them, I'm not talking specifically about diet. I'm talking maybe about stem cell therapy, but I will always tell them that we need to decrease the inflammation in your body. And I give them very simple things.
Yeah.
No dairy, no gluten, no sugar, and cut way back on meat. And if you can do that, just that alone will cut down inflammation.
Yeah, and even as a nutritionist, I see a lot, it's not as hard as you think. You can take some simple things and adjust them in your diet and lifestyle, and it can give you a pretty good positive result. So it's not always complicated, and as most people think sometimes. So, but definitely eating a lot of good veggies. Fiber is really important for balance in the body. Most people eat about half of what we really need. Lean proteins, like Dr. Kremer said, animal proteins, if they're processed correctly, if they're organic, grass-fed, grass-finished, locally harvested, that type of thing, as opposed to a conventional piece of protein. And there's also protein in non-animal things like vegetables and nuts, seeds, right, things like that. So good fats are really good for you. Water's critical, and then sugar, like you said, I always say limit to like 25 grams a day.
Yeah, so I've tried it. I really, now this is me. I don't tell this to, everybody they need to do this, but I don't eat sugar, period. I mean, I may have, I'm not going to completely give up things I love. I mean, I'll have like my strawberry Haagen-Dazs ice cream, but I won't have it very often. Maybe I'll have it like once every couple of months. I'll have some. And so, that brings us to that 80-20 rule. If you stay on a good diet,
Yes.
80% of the time you're going to be fine. I'm not telling people not to live. We
Exactly.
we love to eat certain foods, but we don't have to give them up. We just have to cut back on certain of them. We need to cut them out, and some of them we just need to cut back way back. And one other quick warning, we talk about now I don't eat meat at all, but for those who do eat meat, we talk about getting good grass-fed meat. You have to be careful. I was watching this one video where they're talking about grass-fed meat, and then they were saying, well, they grass feed their animals, and then they send them to the yards to be slaughtered, and they give them a bunch of grains and everything right before they slaughter them. So they're not anymore. They're not grass-fed anymore. So you have to be really careful where you're getting your meat.
Yeah, and I think that's where you get to know local farmers and that kind of stuff, where really the whole history, where it's coming from and how it's treated. Because for me, even a spiritual thing, it's like how they're treating the animals makes a difference, right? You don't want them dying in fear, and we can go on and on about that. But yeah, you're right, absolutely. And then also on the ice cream thing, I don't touch cow dairy whatsoever because it causes migraines for me. And it can affect colon and upper respiratory. However, there's like gelato, for example. Gelato has about 80% less sugar than ice cream. Gelato has actually got some clean ingredients, so that to me is like the ultimate, but I get the dairy-free version. But for my husband, who doesn't worry about that, at least he's getting less sugar, right? So there's always that step up we can do when it comes to enjoying the foods we like, just doing a better version of it. So good points on that. Lifestyle triggers, lots of them, really, right? And in the ER, you saw a lot of people that came in because of lifestyle issues. Smoking, the obvious, really, excess alcohol, smoking, just high stress life, not being able to manage it correctly. And get balance. The diet's a huge piece of that too. Any kind of infections or even oral inflammation can be really problematic. We know that the teeth tie into the body for sure. Poor sleep can cause problems. And then again, like I mentioned, leaky gut, which is really an inability to absorb nutrients correctly. You literally have holes in your GI. And so you get undigested food, toxins that go into the bloodstream and cause a cascade of inflammation, and can attack parts of the body, especially Hashimoto's, which would be the thyroid. So metabolic conditions, even mindset, right? Environmental, like people you're around, are they toxic? That can cause stress. And so those are environmental triggers that can contribute to the chronic inflammation.
And let me just touch base on a couple of these things. First of all, mindset. What I recommend to people, and I just started doing it, I've been doing probably about 2 years now. I started with it during COVID. I meditate every day. And it doesn't have to be long. I try to get to, at least 10 minutes, but a lot of times I only have time for 5 minutes, and again, that's my own level of being busy. But at least I get, even if I only get 5 minutes in, that's great. Now I'm just giving you some things I do, but somebody gave me a workout tank top, and it said on the back of it, "Movement is medicine." So you have to keep moving if we want to keep our bodies healthy and able to do things. We have to keep using it. What you don't use, you lose. That's an old statement, but it is so true. So very important to do these things, and that meditation is a mindset. I even I take a walk, a 1 mile walk every morning when I wake up. I just take a quick 1 mile walk, and during that mile walk, I pray. You know, I do my spiritual things and you know, my spiritual connection, and I'm sure you all have your own spiritual connection, but you know, that's for that mile, which takes me about, you know, 20 minutes. I don't race through the mile. I make it more of a prayer session than a walk. So just some of the things you can do to help your stress levels.
Makes that so important. So when I think about holistic medicine, which is what I do, it's body, mind, spirit. You're looking at the whole person. And with mindset, it is important to set your intentions for the day. Like I start out the same way. I do my prayers in the morning, set my intention, and really just start that day with that mindset. And it really does make a difference. It's kind of what your intention is for the day. So it is important to have that spiritual set too, for sure. So, and then movement, yes. And it does change as we age, but we don't stop moving. We just change things up a little bit, right? Like in my 20s, I did a lot of weights and it was amazing, but you know, now not so much. I do more walking and do, you know, bands and things like that. So you just adjust accordingly. Each decade really is a new season of opportunity to see what works for you, but it is about being active for sure. You're so right about that, especially when most of us sit on the computer a lot, right? During the day, it's like you got to get up and move around too. So good points. Hydration, I like to bring this up. Dr. Kremer, you know how important water is, and I'm sure you have to lecture a lot of people of that, because I know I do.
I always keep that this just happens to be a carbonated sparkling water, but I always keep this on my desk. And that's the important thing really, is to keep it where you can see it. If you keep it where you can see it, you're going to use it. If you put it away, you're going to forget to do it. So
yeah, I just love water. A good clean water, that's important. If you need to add flavor, do some lemon or some mint or something like that. But you should be drinking half your ideal body weight in ounces a day. That will hydrate you, and hydration is so important. It does a lot for a body. It doesn't, it does more than I think people think, right? Delivering oxygen. It helps between meals to drink water too. It helps with cravings.
I tell people, a lot of people, look at it, they say, I have a headache. And I'll tell them, hey, drink an 8-ounce glass of water. And, I would say 90% of the time, their headache goes away.
Yeah, dehydration can cause a lot of problems like that. Yeah, headaches. That's one of the first questions I ask too. Are you hydrating, right?
Right.
So we definitely.
And here in Southern California, it is very easy to get dehydrated because we live in a dry climate, and you don't realize it. So you have to kind of force yourself, like I said, to have something nearby so you remember to drink water.
Right, absolutely. So hopefully those tips were helpful. We did want to kind of chat a little bit about this anti-inflammatory. It's an all-inclusive plan. That means everything's included. It's a month, basically. You get the one-on-one coaching. You get a plan guide, meaning we have an app that you download on your phone. It gives you lists of what to eat, what to stay away from. You can track everything, including your lifestyle stuff, right? Even meditation, exercise, and all of that is pretty awesome. You will get some supplements also. We'll talk about those in a second. It's just really, you're going to have somebody right next to you the whole time, so you can get through this whole program. And again, the way we set it up, it's pretty awesome with the tools we use and just the support alone. So it will tell you what to eat. You're eating real food, first and foremost, and it's an anti-inflammatory diet program. So benefits, we see a lot using this program, and just a focus on an anti-inflammatory lifestyle. It helps pain, right? Pain management. Also, like we mentioned earlier, if you come in the office and get a stem cell treatment or a PRP treatment, or any kind of treatment like that, where you're really addressing an inflammatory area, this can be helpful. Definitely to pick this up right after and just, keep focusing on an anti-inflammatory lifestyle. We've seen it help a lot with weight loss, obviously helps with energy because you're balancing everything out. Just remember, when the body is inflamed, all the energy is going in the body to try to fix things. And so you get depleted, you get exhausted. People don't sleep well, right? Especially if you've got pain going on. So there's a lot of things it can do to help it. It is a lifestyle, I feel, that is that's basically my lifestyle, right?
And that's really what, I mean, what you just, lifestyle is what we're trying to incorporate into each of your lives. You know, I am continually working on incorporating into my life. I've been pretty darn successful because I've been doing it for a long time. But there's always something more to learn, something to try, and it's fun. It's actually fun. It's fun to be healthy, believe it or not. And
it's awesome. Yes, right.
You know, I mean, look, I'm kind of an older man. I'm 77, and you know, I'm basically pain free. Now that's not just, look, I'm 77. I work out all the time, and you know, I do get sore, but not painful. I don't get painful, you know, and I can do just about everything, you know, and I play pickleball, golf. I go to the gym. I work out on a Peloton, and it's just a lifestyle. That's what I'm trying to bring. I'm not trying to brag about what I do, although I'm excited about what it's done for me. But I want to see if we can incorporate you into it to help you achieve results that are good for you.
Yeah, and you know, even for me with anti-inflammatory approach, I've had my autoimmune in remission for 20 plus years. Right? Migraines are gone. I mean, I had a lot of health issues, and it's pretty cool to be on the other side of that. But I also know I got to keep focusing on keeping all of this in check, because I don't want to go back to that. You know, it was debilitating for me, and I was literally in my 30s. So inflammation can hit you like this pretty much at any age nowadays. I've seen younger people now with RA, autoimmune things, right? It's like everything catches up to us quicker these days because of so many outside influences with inflammation and stress and just toxins and things like that. So
yeah, I mean, even besides diet, if you eat, you know, a lot of times just look at your diet, you're going to find a lot of inflammatory things that you may be doing. But how about the environment, the pesticides, the pollution in the air? All of these things can have an effect on the inflammatory response in your body.
You're right, and some things we cannot control, but some things we can. So what we do is we control what we can, right? So that's why this is such a cool focus too. So we have 3 supplements that are also included. I know Dr. Kremer absolutely loves the InflammaPro, has some great testimonies on it, including your own, right?
I'll give you a quick testimony of my InflammaPro. Of all the supplements we have, and we have plenty of great supplements, this is my favorite. And I'll tell you why. I had surgery in my shoulder 12 years ago, and I couldn't put my arm, I couldn't exercise. About 2 years afterwards, I couldn't exercise above my shoulder. And I was taking all the crap drugs back then, you know, like ibuprofen and Aleve and Advil and all that stuff. And I had this nutraceutical rep come in, and he said, "Hey, this will help your inflammation." I said, "Well, give me that bottle, and I'm not going to do anything except that. I'm not going to do any of my crap drugs, no Tylenol, nothing. I'm just going to do that." And within 2 weeks, I'm doing exercises above my shoulder. And the other thing was, I just because I'm a little older, I would like get up in the morning and like I have to almost crank my body straight. That's gone. That's completely gone. Now, like I said, I'm not going to tell you I'm never sore, but that is completely gone. I can function, I can move quickly, and so we have some great supplement. InflammaPro just happens to be my favorite.
Yeah, it's got turmeric, boswellia, right? Also,
yeah,
which can actually help from any cancer cells kind of doing what they want to do. So it's a good preventative supplement as well. So that's a great one. So we've definitely included that. You would take a couple of those a day on an empty stomach. And then we have ProbioSpore, which is a live spore probiotic. As we know, 75% of our immune system's in our GI, and we need to have that rich and balanced and diverse with good bacteria. So that one goes in, it's very smart, and it goes in, and think about the soil, right? In the garden, it's really important to have healthy soil. So the probiospore is a fabulous probiotic that we like. And then the Omega Veil, which is with a TG1000, is a pretty good dose. Omegas are fabulous for battling inflammation. So these three things we handpicked, put them together for this program. They're safe for anybody, so that's a good thing too, right? So yeah, these are the supplements that are included in the program. Any other thoughts on any of these for you?
No, I think they're all good. I've been taking all of these for years. The Inflammatory I've been taking now since I got it for it's probably over 6.5 years now. I take 2 every morning, and I've been doing the probiospore for probably a couple of years, and I take the Omega too. So
yeah, me too. Yeah, I take all 3 as well.
Yeah, so
kind of
they're
like walking examples, right?
yeah, exactly. It's just it's good to do what you need to stay healthy.
Yeah, and these are nice because they're not medications, right? Our goal is to stay away from those and to support the body. Diet's always number 1, lifestyle, and then we come in with supporting supplements. They're meant to support, right? Not replace anything. So again, we have packaged this against a 30-day program, all inclusive, for $395. It includes everything we mentioned, everything listed here again. So yeah, we're super excited about it, and we're on it ourselves, so that's kind of always nice too. But we do offer free consultations. You can also check out this plan on our website. You go under services, it's the first tab, anti-inflammatory plan, or even give us a call. We're happy, either one of us, to jump on a call with you, or if you're in the office too, ask Dr. Kremer, right? Because he'll definitely, you've got brochures and information on it too. So hopefully that was helpful.
Yeah, so the great thing about our program is we don't tell you what to do. We live what to do.
Yeah.
And we explain what we do so you can do it too.
Yeah, exactly. We don't just preach.
Right.
Yeah. So hopefully that was helpful, and we're excited to have done this video. We're hoping to do more. This was a really fun one we wanted to get out there. So get in touch with us, delmarim.com, or give us a call, and we're happy to help you.
Great speaking with you. Thank you, Sandy.